Do you feel like the health system is broken just the way they, why did you, I'm from the healthcare world. So I spent 20 years of my career, although on the HR side, but in the healthcare system. Yeah. So I did it for hospital system, medical groups, behavioral health, home care, you name it. I have the healthcare experience.
Right.
So okay. I know.
It's broken.
No, I just want to hear it from you.
Yeah. I'm trying to be, I've said that very statement, the hospital system is broken, and I'm trying to be more positive in my language. Mm-hmm. And I would probably say the focus and what drives the healthcare system is broken. And you'll hear companies saying, oh, we're going to put the patient first. But how are you putting the patient first if they only get 10 minutes with their doctor?
Right.
Like, I mean, that's not even enough time to figure out what's going on. And I just don't, and again, that's why I love lifestyle medicine, because we're getting to the root cause.
Yeah.
And trying to help people build, a life of health and wellness from the ground up.
Yeah.
It's broken. And I'm gonna just say it. I'm having an emphasis on physician burnout. The people that are providing the care are burned out.
Wow.
They're burned out. Especially these older doctors. I mean, there was a time where you could do what you needed to do with your patients. You didn't have to answer to insurance companies. And now it's like there's all of these people telling you how to take care of your patients, which, okay, if I just talk with the peer-to-peer, then they approve it. But it took it took a day for me to get to talk to somebody. And then that delays my patient's either diagnosis or my patient getting the medication that they need. On top of that, there's something called the electronic medical record.
Yeah.
Which is great. I love it for patients because you can see your labs, you can see the notes. But for us on the opposite side, we've got to put in all this data.
Mm-hmm.
And that takes time. So we see our patients during the day, and then at night, we're putting in all the data. And so it's not the same. And I definitely think that when we learn to adapt, it gets better. But we're not taking care of ourselves. We're just not. And COVID highlighted that.
Wow. And it's important. I'm so glad you said about the physician burnout, because I've seen it and they're exhausted. And how are they supposed to give back or pour into a patient when themselves are not well? They're not
right.
At their best. They cannot operate at their best. And what's really sad for me is that the organization don't really care about the people providing the care. They care about the bottom line that you guys are generating. And
right.
Not too much.
Right.
That's a whole nother fight.
We can't be widgets. When you're talking about patient facing, and for me, having people's lives in your hand, you can't look at that on a spreadsheet.
Right.
And just put all these metrics in. It's a different animal.